is the organ within the bone from where the blood cells are produced. We know that we have three types of blood cells, that is red blood cells, white blood cells, and platelets with different functions. The bone marrow transplant is replacing the diseased marrow, defective marrow, with the healthy one. The conditions where we use bone marrow are definitely blood cancers or leukemia. Then other conditions like aplastic anemia, where bone marrow can't produce blood cells. Then there are some genetic disorders like thalassemia, sickle cell disease, and there are some hematological malignancies, blood-related malignancies besides leukemia. These are multiple myeloma, lymphoma, that is the malignancy of lymph nodes. So these are the conditions where we do bone marrow transplant. Basically, the bone marrow transplant is of two types. One is autologous bone marrow transplant and another is allogenic bone marrow transplant. In autologous bone marrow transplant, we use the stem cells from the bone marrow of the patient only, from the same patient. And in allogenic transplant, what we do is we collect the healthy stem cells from a healthy donor. It is not the patient from whom we are collecting. All the complications, as the patient doesn't have any immunity during those 2 to 3 weeks time, the patients may have a lot of infections. Not only the bacterial infections, the patient may have fungal infections, patients may have different viral infections, and if the patient develops some infections, we need to give some broad spectrum antibiotics, antifungals and antibiotics. As the patient's blood cells take some time to produce new cells, the patients are very much anemic. Patient's hemoglobin becomes too low. So during those periods, we need to support by blood transfusion, we need to support by platelet transfusion. All of us have immunity. So we reject the outside cells always. That's why we can't accept the blood of anybody else. That is, the stem cells which were transfused, the patient's body may reject that graft. So patient can't produce new cells. Nowadays, there are more than 100 transplant units in different states. But there are some states where there is bone marrow transplant facility. That is also there. So on an average, 2,000 to 2,500 transplants are done every year in India. But it sounds that the number are big, but it is not as big as the requirement. BMT cost is till now not in the reach of most of our common people. So it is expensive. On an average, it depends, but roughly it is for allogenic transplant 12 lakhs to 15 lakhs. And it may go up to 70-80 lakhs also if the patient develops much more complications. So it is expensive. But the positive thing is now many government hospitals have started providing support for bone marrow transplant, and different NGOs, different funding institutes, agencies, they are supporting.